Good evening. This is our Vision Committee for City Council, and today we have a subject on homelessness. And this is something that we have, as a community and a county, have been working really hard on in the last, a couple of years, but especially the last 2 years. And there's been a lot of successes and results, and we have quite a few people that are on the team that are making these real results happen in Cañon City to solve homelessness in Fremont County. And so I would like to introduce Chief Schick and Amanda and Dee Dee, and we'll be inviting some more people from the CCPD to report on their work with the homeless as well. I'm going to go ahead, if that's okay. I'm going to turn the time over to...
Roll call first.
Oh, roll call. Always forget that.
Councilmember Dennehy, absent. Councilmember Gonzalez, absent. Councilmember Jaquez, absent. Councilmember Reed, absent. Councilmember Schmischer,
Here.
Councilmember B. Smith,
Here.
Mayor Pro Tem Hamrick,
Here.
Mayor Smith.
Here. And now we'll turn the time over to Dee Dee Clements from Loaves and Fishes.
First of all, just want to say thank you, Madam Mayor and City Council, for just allowing us to come and talk a little bit about what's happening with homelessness in our community and just some of the work that we have been doing together here. I just have a really short kind of PowerPoint presentation. Feel free to ask questions as I ramble along. I have a tendency to talk really fast, so if I need to repeat something, just let me know. So, as Madam Mayor mentioned, we have joined the Built for Zero community, which is through Community Solutions, and we actually joined it in October of 2019. And you will see that Community Solutions is a nonprofit that works with other communities across the United States to help them end homelessness. And so in the state of Colorado, there are actually 9 other communities that are Built for Zero communities. And then you'll see that there are 14 communities that have actually ended homelessness for their veteran. And Fremont County is number 13, and we are actually the first county in the state of Colorado to do this. So yay, Fremont County. And then you'll also see that 5 communities have actually ended chronic homelessness. And over 134,000 individuals have actually been put into housing since 2005 through the Built for Zero movement that's been happening. So this is our timeline. As I mentioned, we joined in October of 2019, and then we had a big kickoff event here at City Hall. We had over 100 people. It was pretty exciting. We had 3 asks, and we had sign-up sheets, and lots of folks signed up, and we're part of outreach, and we're part of case conferencing, and just doing some other things to make this successful. And then in December, we actually had our first case conferencing meeting. And so what that means is that every veteran and every individual who is chronic homeless, meaning that they've been homeless a year or longer, we actually meet twice a month and we talk about that person by name. And we talk about literally the next step that that person needs to do to get into housing. So it's very action focused, it's and very client centered. We have someone around that table who has regular contact with that individual so they understand what their challenges that they're facing. So we really treat people individually instead of putting them in mass groups. Then in February, we had our first outreach. So historically, outreach has been happening in our community thanks to the faith community. They have been doing outreach in our community for many, many years. But we never really had any kind of coordinated effort, and we really weren't talking to each other very well. And so through the Built for Zero, we actually started doing that. And so we have a coordinator who kind of oversees the outreach and then works with all the churches and all the different agencies that are doing outreach. And so we just have a better idea of who is actually on the street. Before we never really knew, now we actually have a list of individuals, we have contact information, all that kind of stuff about who's actually on our streets right now. In March, we were actually able to hire, when I say we, I mean the team, not necessarily Loaves and Fishes, just Built for Zero. We were actually able to hire a housing navigator, and Amanda's going to talk a little bit about that position, and that was another game changer for us because the housing navigator focuses on finding housing for our clients that oftentimes is very difficult to find housing for. And so she works really closely with our landlords, and you'll hear more from Amanda. And then another key piece that we were able to do in August, Loaves and Fishes is actually able to hire a full-time outreach caseworker, so a street outreach worker that actually is on the streets pretty much every single day, working with people to help them get documents, helping with transportation, helping them get to medical appointments, helping them to get into housing. They work really closely with the family navigator. And so that was just a barrier that we saw with a lot of people experiencing homelessness. We could tell them, hey, there's an apartment opening over here, but they had no way of getting over there. And it was unrealistic asking them to maybe walk 4 or 5 miles to a place. And so this outreach caseworker is actually helping filling that gap. Then we, as you already know, we have an amazing housing authority here in Fremont County, the UACOG, and they have a great relationship with the Division of Housing. And because of that relationship, they were actually able to acquire more housing vouchers. And so in September, they actually received 11 additional housing vouchers, which focused primarily on individuals who were experiencing homelessness, and I think all of them were people experiencing homelessness. So that again just helped people get off the street. Many of them have income, but it's not enough to pay rent, and so this voucher allows them to get into an apartment. Then the other thing we did was in October, I told you that we were doing the case conferencing twice a month, but we really wanted to end veteran homelessness. And so we actually started doing weekly case conferencing. So again, the point of that case conferencing is we're talking about that veteran. What do we need to do today or between today and next Tuesday to get this gentleman to housing? So very action, like I said before, very action focused and wrapping around our services. A lot of people on that conversation, Housing Authority, we have veteran representatives that are there, and so just the right people are having the conversation to do whatever we can do to get these folks housed. Then in January, through Community Solutions, we actually received a grant of $30,000, and that $30,000 was to help with housing. And so we're able to use that money to pay deposits. We're able to use it to pay first month's rent. If we need to pay 2 months' rent, we can do that. It's just, again, whatever we need to do to get someone into housing, it just really helps support this. And so that grant came through, you'll see the Balmer Group, but it was really Community Solutions that made that connection for us. And then in January, I talked to you about those COC vouchers, the Housing Choice vouchers. We started, there were a lot of people out there that actually had housing choice vouchers, but again, we weren't necessarily talking about them on a regular basis, and we're like, you know what, we need to start doing that. We need to talk about these people that have a housing voucher. What do we need to do to get them into housing? What landlord do we need to talk to? What transportation needs to be provided, whatever it is. And so we started doing that, and that happens every week, and we have Amanda and her team on that, and that's been very helpful because it keeps us focused, right? It's not like weeks later, like, oh yeah, I'm just making up a name, Tammy Smith. You know, we're not doing that. We're talking about her every single week. Then February, yes, Fremont County reached functional zero, and we celebrated that in April. And then in April, we actually were able to hire, and you guys helped us because I talked to the city council. You guys provided us with, or the city of Canyon City provided us with $10,000, along with Fremont County, and again, Health Colorado provided us with a grant that allowed us to hire a full-time coordinated entry. So this has been a game changer, because prior to all of this, all of us who already are doing a bunch of other things, right, are doing this coordinated entry, trying to make everything happen and making all these connections. Now we actually have someone who this is her job, that she just focuses on coordinated entry, works with the outreach team, works with, there's a database called HMIS. She works with those folks. The person that we hired actually is a data girl, so numbers just come natural for her. And so this has helped us move forward. And then in August, another great thing happened. Department of Human Services was actually able to hire a full-time street outreach worker that focuses on families and youth. So Loaves and Fishes street outreach worker is now shifting to just work on focus on single adults, and this person then is now going to work with all the family and youth. And so 2 years ago, like I said, there was no outreach, right? Except for some churches doing some really great work. Now we have 2 paid staff, along with a coordinated entry, and now a housing navigator. So a lot has happened, and you guys have been very supportive, so thank you for that. All right, this is just showing some numbers. So that this is a list, or these are the numbers of all the people that have been experiencing homelessness from October of 2019, when we first entered into the Built for Zero, until July last month of 2021. So you can see that we started off at 340. We spiked in January at 396, and then we kind of been steadily going down, a little bit of spiking, but today we land at 209. So we have made some progress. Yeah, I think that's a pretty amazing chart of all the work that's been done. So, and I think it's also nice to be able to say that we have 209 individuals who are experiencing homelessness in our community, and oh, by the way, we know their names. We have never, ever been able to do that. The only time we ever knew how many people were experiencing homelessness was when we did our annual point-in-time count, and that was in January of every year. And so now we actually, we can say every day, this is how many people are homeless, how many people are on our streets.
Dee Dee, can you go to the previous slide again?
Of course I can.
And I just want to get your input, because in October of 19, I mean, that's when we just barely started, and we didn't even have homeless outreach.
Mm-hmm.
Do you feel like as the time progressed, because now that we are so much more organized and have so many more boots on the ground getting out there, that perhaps, I mean, the numbers of 209, that's because we know every single person, even if they're probably just traveling through for a month or a couple of weeks. Whereas in October 19, there were probably, those are the ones we knew about with zero outreach, practically zero outreach, and there was probably a lot more than that, just because now we have so much more data.
I would agree with that. Yeah. Yeah.
So
there were
I
probably,
feel like we've probably done a lot more work than what this
Right.
chart shows.
yes, you're correct, Madam Mayor. There probably were more than 340 people. That was just what we knew at the time, with no outreach. Correct. Yeah.
Could I ask a couple more questions just
Sure,
on this? 'Cause
sure.
it's such an amazing chart. I was wondering if the slight uptick might also be seasonal. Like, do we think that there is a higher transient population during the summer?
So, are you referring to the 138 and then the 206? Is that one of the?
I mean, the 206 and the 209, and then also it looks like there was a little bit of a peak, if I'm getting the, well, no, I might not be getting the months correct, for the 236 to 261, 270. Like, I'm wondering if that's like a little bit of a seasonal trend that we should just expect, given our location and weather.
Right. It is true, and law enforcement will probably say the same thing when they're here too, is that we do see more people passing through our community in the summer. They may not be staying, but as we mentioned earlier, our outreach team is identifying them quickly, and they're getting on our list. We have a way of removing people on our list so they're not like stuck on our list forever and ever. There's a process that we go through. But yes, I would say historically, we do see people come into our community in the summer. The other thing is though, we've also heard that in the winter, especially really cold parts, people will come here because we have access to water. That was one of the things that we've heard in the past, is that Fremont County has better access to water than maybe other communities around us. I don't know if that's through the streams, or maybe if businesses just allow them to fill up water jugs, that type of thing. But that was just one of the things that we've heard.
Oh, so it's not because the lines are short to get their food stamps, it's because we have the Arkansas River running through town?
I don't, yeah. We have amazing providers too, right? I mean, we live in the best county in the state of Colorado, so.
And then, sorry, just one other really quick
Sure.
question. Do we think that the 209 is pretty accurate? Or, I mean, I feel like it's probably a little bit like every time you go out there, there may be more rocks that, there may be more people
Yeah.
that you didn't know about. Like, do we feel like we now have our arms around the issue and that 209 is a really valid number? Or do we think that there may still be more people in the hinterlands?
Yeah. I would say that 209 is a good number. There are probably people that we have missed, I'm sure of that. What we do now is before we would not put someone on the list until actually we had all of their contact information. And that's one of the reasons why you see the change from 138 to 206. Because the 206 is when outreach went out and maybe they just got a first name, we started plugging that into the by name list because they were like, as we were thinking about this person is homeless, this is what this represents, even though we don't have all of their contact information, we still want to count them as part of being homeless in our community. So that's a reason why you see that 50 or 60 difference there. But the other thing is, of the 209, there are probably people who have been housed. And even though we contact them regularly, at least for those who are chronic and veterans, they're contacted all the time because we're talking about them all the time. The ones that are not chronic, they're contacted at least monthly and sometimes more often than that. And so sometimes they self-resolve, and then we may not find out about it until several weeks later or whatever. And so the 209, I think, is, I feel pretty confident about that. Yeah.
I would say, just as an example of how much information is about each of these people, you know, just one person out of that 209, Dana Sweatland, who also works at, is it UCOG? She's also been helping to develop relationships with landlords, and that's another, I'm sure we'll hear about it, a really important piece of having them be comfortable renting to people who have been experiencing homelessness. And she found a landlord that she thought that this particular gentleman who's homeless would be a good fit here because we want them to, wherever they go, to be successful, so they stay there long term. And she literally went driving through the mountains looking for him in the woods, and finally found him and knocked on his little tent and said, "Hey, we found a place. Do you want to move into an apartment?" And he had a daughter, a youth. And she said she saw him a couple months later and didn't even physically recognize this gentleman because he was so much more healthy and productive. And those are the stories behind that 209 of just how personalized your efforts are, and passionate to help.
So this is actually how we did it, and I think I've covered a lot of this already, but I talked about we now have real-time data. We're talking about our chronic folks at least twice a month. We're talking about our veterans and everyone who has a housing voucher weekly to get them into housing. You can see the impact there. You can read that for yourself. Our outreach is now organized. Not only are we working with the other faith community that are doing outreach, but our outreach coordinator had made contact with law enforcement. They were talking on a very regular basis, the BLM, Park and Rec. So those relationships are hopefully starting to be restored some. I will mention that we do not have a coordinator right now. We are looking for one. It's difficult because this is not a paid position. I think you saw the improvement that I was sharing with all the other ones, but right now we're just filling in the gaps the best we can. So, but amazing work was done through outreach. And then the critical staffing needs, and I already mentioned all of those. Those are key to help us to reach functional zero. And for a new goal, which is you're going to see, because I am all about the goals. I mean, if we're going to do something, let's put something on the wall and work towards it, right? And so we are working towards, again, we as all of us, Fremont County is working towards ending chronic homelessness. I put July 2021, which is in that little white box at the bottom, which is an error. It's supposed to be July 2022. But in order for us to really achieve this, these are the steps that really need to happen. So we really need your support. We really need City Council to believe in the work that we're doing and the stories, and that this methodology that we're using is working. We need our community to believe in that, and so we just need the faith that we can end homelessness. We can do it. The next thing that we really need to focus on is and we're doing this is when we meet with our case conferencing, is really staying focused on why we're meeting. Let's stay focused on what we need to do to get this person into housing. Sometimes it's easy to get sidetracked because the work is tough. You can imagine the work is tough, and sometimes you just need to just talk, but we can talk for a while, but then we need to get back to why we're meeting, right? This person is a person, this person wants housing, let's do what we can do to get this person into housing. And then, Madam Mayor had mentioned this, is that we are really working hard with our landlords, and so one of the things that we do not have is a shared landlord resource list that all of us are using. So as Madam Mayor mentioned, Dana has connections with landlords. We have housing programs that they have connections with landlords. So we may, Loaves and Fishes may identify a one-bedroom apartment, but we don't have anyone that needs it. Well, Dana needs a one-bedroom apartment, but we're not talking. And you're like, why aren't we talking? And so, we're actually creating this shared resource where as apartments become available, Dana can tap into it, and she's like, oh, there's a one-bedroom apartment. And or we can tap into it and say, oh, there's another one-bedroom apartment or whatever. So it's just communicating with one another. We're just working better together. Let's just say that. And then the other thing is we want to build stronger relationships with our landlords, and we need to identify new relationships. And we also know that there have been landlords that have been burned by us, by Loaves and Fishes, and we need to restore that. And so we are actually in the process of taking steps to do that. We're going to be meeting with some of those landlords and saying, man, we screwed up. What can we do to restore this? Because we need you, because it's a partnership. But yeah, let's figure this out so we can move forward. And then our first goal is by November of 2021, we currently have 49 individuals that are chronic homeless, and we want to actually reduce that to 25. And then that will get us to functional zero by July of next year. And for us, for Fremont County, that would be 3 or less. So 3 or less chronic individuals by July of 2022, excuse me. That's the goal. It's going to be a reach. We know it's a challenge, and when we establish that goal, we're like, oh, can we do this? And we're like, you know what? We're going to do this. We're going to give it our best effort, right? And so if it doesn't happen in July and it maybe happens in September, it's okay because we're going to reach it. That's the end. That we are determined to end this. So that's all I have for you, subject to any questions that you have for me.
Sure. Thank you for being here, Dee Dee, and thank you very much for the work that you're doing. It is just great. You know, the council has been engaged on this issue and you know, actively seeking ways that we can help. We've looked at different aspects of the issue, including homeless that wanted to camp in city parks, and we had to establish an ordinance that said, no, we can't do that. But at the same time, you know, working with you and the others engaged, especially our mayor has been really active in this area, working to find solutions for those people so that we can, you know, achieve something here. And every reduction in number and every number up there is a human story, and it is so important to remember that and to realize that this is, we're helping people, and we're helping people start to move towards achieving their potential, because every person has the potential to do good, and we want to foster that wherever we can. So having said all of that, one of the things that I'm interested in are kind of being a data boy. Are some of the metrics involved, and I don't know if we have a way to put our hands around that, but from you know, and I don't want to overemphasize this, but it is a question that perhaps you know, has a good answer that can help support us, support you, and that is, without this work, we have a lot of calls on our public service systems. including our police department, our social services. And with this in effect, with all the work that you guys are doing, do you have some feel for, what kind of reduction we're seeing? I mean, it really, it sounds like it's a garden. And it requires constant attention to really be productive. But can you share a little bit with us about your thoughts there?
So are you talking about like reduction, like less law enforcement
Less law
contact and
enforcement.
emergency room visits?
Yeah, things like that. I mean, I'm interested in if there's any measures that we know of out there that we can, yardsticks that we can use to say, hey, look, here it was here, now we're here, or whatever.
Looks like Chief might have an answer.
That's a great question, Mr. Hamrick. And I can tell you, when I came on at the beginning of the year, Dee Dee and I met, and that was one of the things that I was very interested in, is trying to establish that metric so we can have a measurement to barometer to tell us how much success we're having with regards to homelessness and what impact it's having on police services. So right away, I reached out to our co-responders. In fact, Mr. Snyder back here helped coordinate an effort to get a tab built within our records management system so we could note when a particular crime report was directly related to a homeless situation. That data is it's a new thing, so we're easing into it. It's trying to get everybody onto the new protocol and remember after they do the crime report and get the witness statements, take the photographs and all these other things to hit that tab. But we've seen over the last several months that number is increasing. So I think we're starting to get more of an accurate picture. Certainly, we're very interested in what that number is going to look like a couple years out. I can tell you today, just pulling those numbers, that kudos to Dee Dee and all of her hard work and UACOG and all the outreach people, because when you hear 209 or you just go to 49 current homeless, the numbers that we're reflecting in terms of crime reports related to homelessness is very low. We average monthly about 15 to 20 calls a month related to homelessness, and they're all very minor calls. We're talking about shoplifting, we're talking about trespassing, we're talking about disorderly conduct. Very minor misdemeanor nature calls, and our highest month was May, and that was 25. So I credit them with the resources, the outreach, not requiring homeless people to commit crimes to thrive and survive out there. I like to think we're part of that, and that our officers were constantly pursuing ways to decriminalize homelessness, because we know that homelessness brings with it certain needs that might contribute to certain crimes. And so we're looking for those pathways. We constantly are working with our resource peers. But getting back to your question of the metrics, we're looking to do that. And in fact, just recently, our crime analyst talked with ITI, who is our records management software company, and I told him I would like to go a step beyond the crime reporting. I would like to find an interface with our CAD system so that our dispatchers could start entering some sort of feature that relates a call to homelessness that didn't generate a crime report, so we can get a better picture of exactly what that footprint looks like. So we're working on it. I'm hoping this time next year we'll have something more productive for you to discuss.
It really would be interesting. I wish we had that data probably 2-3 years ago, because
ma'am.
I think we also need to contribute a lot of that reduction of 15 to 20 to our co-responders and our park ranger. We have Marcy, Officer Snyder, and Officer Zabruski. And before the co-responders here, when they very first started, I remember do you remember there was like one gentleman that had 140 police calls in a matter of just a couple of months? 140 just for one person that was experiencing homelessness. And so with Zabruski out there, probably making 3,000 face-to-face contacts in his time already. I mean, there's the whole matrix that's putting this together. So I'm actually just floored that we're down to 15 to 20 calls.
It is
a month
remarkable.
now.
Yes, ma'am.
Although I think we need to count all the preventative calls,
Well,
which is
there's-
much better than,
There's a proactive
others.
number that's not
Yeah.
reflected, and if we get that CAD interface that we're talking about, then we'll have those numbers.
because there's a ton of prevention that's going in there.
And I would, that's a great point, I would like to see in that reflection, the proactive measures, the responsive measures that don't generate a crime report.
And it's way better to have, it's way better to have them out there in a proactive way, because before they were
Absolutely.
being called because machetes were out at Centennial Park, or there's
Absolutely.
needles at,
Yes,
it was,
ma'am.
they were bad calls.
Well, and as Dee Dee
Yeah.
reflected and Pro Tem Hamrick, it's a personal story. Each and every one of these people they're people. So the more we build those relationships, the less likely we're going to see those events.
Well, and I just wanted to add that when I first started on council, this was a topic of, of a lot of discussion. We had a there was a different administrator. There was essentially a different council, and a different police chief. And if I remember correctly, Madam Mayor is correct, it was not, 29 might have been a really good couple of days,
Sure.
Because when we started, it was kind of like the Wild West, really.
It is absolutely a credit to the outreach of these peer resources, these park rangers, co-responders, and our patrol folks, because we've adopted that posture that, we're going to engage these people, we're going to have relationships with them, so we can avoid putting people in jail because they're homeless.
Thank you. Any more questions for Dee Dee? Otherwise, we'll move on to Amanda.
I just wanted to thank you for your presentation and thank you for having such an audacious goal. I think it's evident through your hard work and dedication that you were able to already, you collectively, were able to already achieve a really audacious one in terms of the functional zero for veterans earlier this year. So I love that you're thinking big. I love how much time and energy and passion and also attention to detail and nuance and figuring out what works and figuring out partners who can help you. And I just thank you.
Thank you.
Thank you all for having me here tonight. So our Housing Navigator program, what is a Housing Navigator? It's someone who assists our veterans, chronic homeless, youth, families, and individuals who are experiencing homeless to find affordable housing. March of 2020, we were able to finally hire a Housing Navigator for this. What she does, I can get this to work, there we go. She helps with families who come in that don't have those documents that they need to be able to receive a voucher or get services from DHS and that kind of stuff. So
Or
she
even a
helps them
job.
yeah.
Yeah.
So they don't. I mean, they lose them. They have them in backpacks. So we're able to help get photo IDs, social security cards, birth certificates. She also helps them with their challenges and barriers that are preventing them to get into affordable housing. Some of those barriers that we have seen in challenges is they're unable to complete housing applications. Some of them just don't have the ability or the skills, or they're just intimidated by the application. So we're able to assist them in completing that. They may not have the internet, or they have a cell phone that is provided by the government, but you don't have the ability to actually fill out an online application. So we're able to assist and bring them in to do that. They don't know how to advocate for themselves. They tend to be intimidated when it comes to speaking to landlords. Sometimes they're intimidated coming and talking to us. So she works with them on building that relationship and gaining their trust and teaching them how to speak with landlords. We have several times where we've brought in the client and a landlord and have just been there, so they had that support. Loaves and Fishes has been amazing with providing that support as well, because they've established that relationship with the client, and we've had that relationship with the landlord to get them together. We've also, there's not a lot of resources out there to provide first month's rent, but Dee Dee was talking about the funds that they were able to receive with the $30,000. That was a resource that was huge for our program as well, and going out and finding other resources available to them. Some of the barriers that they have is bad rental history or no rental history at all. When you've been on the streets for 3 years, a landlord's not going to take you if they don't know that what kind of history you have in a rental. Or they have a past eviction, or they couldn't afford their rent, so they were evicted. No rental history at all. Bad credit. Behavior and physical health challenges which make it difficult to complete the housing search. Justice involvement. So we tend to work with these families and advocate for them on the services that we provide, all the wraparound support from the UCOG, Loaves and Fishes, DHS, Sol Vista. We have so many people who are working on this team wrapping around these families, and so that's how we're overcoming some of these barriers and challenges is because we're providing that for the families. Our Housing Navigator goals is to continue to help our homeless veteran population remain at functional zero. We're also moving into that chronic homeless piece, so that's going to be another goal for us. Continue working with our clients to get those documents that they need and continue finding the funding to continue doing that. And then working with the community and keeping them involved. So I want to share some of the things that the community has done for us. Oh, I don't know what I did. Okay. So it went through real quick. So a couple months ago, we asked the community to help in providing move-in baskets for our homeless. We learned one of those things that came back from some of our landlords is these families don't have cleaning supplies. They don't have hygiene products, laundry soap. They have nothing. So we asked the community to help us in providing those. We asked for 20. We have received over 100 baskets from the community. And that's one of our offices that we did not expect to have completely full of supplies. That right there just proves to us that the community is supporting us, and thank you. We appreciate it.
Can I share a little story about the picture in there?
Yes, there's a reason they're there.
Yeah. Well, first of all, part of this is more than just giving them the cleaning supplies. It's also teaching them, okay, now that you're living indoors, your landlord has expectations for you for your living environment. And so part of it is giving them supplies, but also training on how they're supposed to live so they can be successful in there. Yeah. And also for the landlords that they're just not dumped off at an apartment and left to fend for themselves, but there's somebody walking along to make sure that they gain that confidence and the life skills so that they can successfully live indoors and have a better life, because it's more than just having housing. But the reason my two little boys are down in there who dropped off those cleaning supplies, but the important part is that those cleaning supplies came from one of our former city employees. If you remember, Mickey Wells had passed away. She was in the finance department. And so I just wanted to recognize in her honor that the boys and I were able to go help clean out her house and her estate. And it felt good for in Mickey Wells' honor to be able to bring those cleaning supplies to help and keep going even though she's passed on. And so I just wanted to put a little plug in for her.
Yes, and we've also told families as they receive a basket, if they run out of something and don't have the funds, we have stuff. We will help you. I mean, if you ran out of bleach and need to get your house cleaned up, come see us. We have some bleach or hygiene products. We're trying to keep that stocked so that we can continue with that. And then here's just a few of our families who are able to receive baskets. And then any questions that you all may have for me?
I don't have a question, but I have a suggestion. Do you know Alan Woolsey?
That name sounds very familiar.
He has a part-time auction business where they go to estates and conduct estate auctions. They're on the web, Woolsey Auction Company. I would suggest you get in touch with him and say, Alan, if you are cleaning out an estate and there's cleaning supplies or perhaps even unused bedding or unsold bedding, sometimes that happens at the auctions, there may be a connection that can provide goods for you all to get out to the right people.
It's a great idea.
That is a
Thank
great
you.
idea, because when we were cleaning out Mickey's estate, we're like, what do we do with cleaning supplies? Because most people don't take them.
Right.
But yet they're,
There's
you
a
know,
need.
they're like,
Right.
some of it was just like brand new, ready to go. So, and we also donated a lot of the bedding for homelessness too, so that's an excellent suggestion.
I had a question about landlords. Do you guys work with landlords on like first, last, and deposits and those kind of things, or how does that work exactly?
Yes, so some of our vouchers do come with that security deposit, which is typically first and last month's rent, and then an additional amount of money for that. So some of our vouchers come with that, not all of them, and so that's where DD and some of the funds that they were able to receive does help with that piece.
Awesome. I know I have a couple rentals, and I kind of keep them for StarPoint people, and we kind of waive some of those things, so I didn't know how that worked. And my next question was, there was a couple of kids last year that did a high school capstone about medical supplies for homelessness. And did you guys receive any of those? You did? Awesome.
Yeah, they've done a great job. In fact, they come regularly and restock our shelves. They received the grant from the St. Thomas More Hospital.
Awesome.
Yeah, so, yeah, it's
We, at my business on Main Street, we filled the box like 8 times, so I just wanted to make sure that it was getting put to use. And also to echo Councilmember Schmischer, I commend you guys. I wasn't as aware of the homelessness problem prior to 2019 when I decided to run for council, and I was appalled at some of the things I was seeing. And looking at other communities our size in Texas, California, they're in the thousands. So 209 is quite an accomplishment, so thank you so much.
And, oh, sorry. I was just gonna say thank you, and then, give you a couple stats. We must have missed those somehow. So when we started, our housing navigator was hired March 2nd of 2020. And, with that, we have housed 92 people in our community. We've been able to assist 345 households. 36 of those did not meet some of the requirements for the program, and so we referred them out by either sending them to the resources that would be able to assist them, or just gotten them in contact with the landlords or property managements. And then we have 84 that aren't currently engaged. However, she reaches out to them constantly, trying to pull that back in and build that relationship, and how to get them engaged again. So I just wanted to share 345 people that she has worked with in our community.
in less than a year.
And less than a year.
Thank you so much for that. And I'm sorry, I don't think we've had the pleasure of meeting before, so I'd love to, I'm not quite sure if you're with Loaves and Fishes or UCOG or a separate organization, and would just love to hear a little bit more of the background there.
Yeah, my name is Amanda Morelli. I am the Regional Housing Director for the Upper Arkansas Area Council of Governments. I started July of last year.
It's like all of this is brand new stuff, and look how much they've already been doing. I can attest they've been working so hard. It's been really awesome to witness.
Thank you.
I think we're ready to move on to you, Chief Schick, if you'd like to give us a report from your side of things.
Well, thank you, Madam Mayor, and I just want to, I want to thank Dee Dee and Amanda. It's remarkable the work they're doing, and you're absolutely right. It's reflected in those numbers when we think about what could be, and the fact that they are engaged at the level that they are, I think directly reflects on the impact that it has with regards to our services. So I'm really thankful for them and all of their hard work, and
Oh,
of course,
yes.
council's commitment to that, because it would be a much different story if it weren't for them.
Absolutely. I do have to share one more story. I know, Dee Dee, you're going to hate me for telling this. I tell it all the time. But we were having, and this just kind of shows the commitment of this entire Built for Zero team. We were having a meeting with the National Community Solutions, and they had just barely received like a $100 million grant. And this is right when we reached functional zero for homelessness. And they were like, if we could just bottle Dee Dee's energy, it would be worth $100 million, because they were part of that story that helped get them that money. And we have to times that by every other person that is on the committee or the homeless outreach or all the stakeholders. I mean, you're two people, but you're representing an entire room. We could fill an entire room full of community members that are part of the success story.
Yeah, I would just like to add, I mean, almost all of our service providers in our community are part of Built for Zero. Many of the faith community are part of Built for Zero. So it is much bigger than UACOG and Loaves and Fishes and the co-responders. But yeah, there's a lot of people that are making this possible.
All right, back to you, Chief.
Well, I don't have too much to offer there. I would like to, we talked about the data and the numbers that we're hopeful for, and certainly the resource impact on our services. I think it probably behoove us to bring the co-responders up and Park Ranger Zabruski, if you guys want to
Come on up, all of you. You're an important part of this journey as well.
Because of that outreach, that level of outreach, we have a very small footprint of homeless that we engage regularly on the streets that aren't responsive to the efforts of the outreach. And many of those issues we're addressing on a daily basis. We see problems in areas such as Macon Plaza, and we start to see vandalism. We start to see narcotics use, or at least evidence thereof. And just in light of recent events with Macon Plaza, we stepped up our patrol watch efforts. We resourced or reached out to Parks and Rec, our Parks and Division, and we were able to, again, looking for ways to decriminalize this so we're not arresting people just because they're homeless. But we found that the main attraction in our parks and in places like Macon Plaza were the power outlets overnight, charging phones and things like that, bringing a lot of folks in there. And then there were a few that were, making it intolerable for the rest of them. And, so we at that point, we're left with no options but to, again, look for ways to transition them out. Now, we're not resolving anything. They're just moving from one area of the city to the other. But it's the continual efforts of these folks making those contacts and engaging them that help minimize that impact. So I'll let Mr. Zabruski start off. Ken, you want to tell us about
Yeah,
what
let's
you're
make
seeing
sure he
and
has the mic.
experience?
The only thing we're seeing right now is, well, the change of the season. That has a lot to do with it, because we're going from summer to fall, and people are moving on more. The power outlets, they've been cut off at the library. at Depot Park and at Vets Park. They're just turned on for special occasion. But short of that, they're moving along quite well. As a matter of fact, today I've met 2 brand-new ones who were just broke down, and they're moving on. They should be gone as soon as this is done. So anyway, long story short, they're moving on. I make contacts with them throughout the parks, and by 11 o'clock at night, there's nobody in the parks. Maybe at 1 o'clock in the morning, but at 11 o'clock at night, there's nobody in the parks.
How would that compare to when you started as a park ranger?
Well, you ran into the same ones over and over again, but they just move from one park to the next. Centennial Park, we never have had an issue. And I guess it's an understanding with the homeless that they're not welcome there, which is okay.
It's designated for families.
Yes, exactly, yeah. But sure, like I said, I've seen less and less, and they're just moving on.
So for a while, we were having like arson or fires like built at the train depot. We were having our bathrooms were like living quarters and
Well,
lots
yeah.
of needles. How is that looking currently?
We all lock the bathrooms, the restrooms at 11 o'clock at night when the park closed. But because of that, we started anywhere from 8:30 to 9 at night, and that's cut down a lot. As a matter of fact, all the restrooms are up and running because everything's been fixed. But that's not because of the homeless, that's because of kids tearing up the bathrooms.
The kids are tearing up the bathrooms.
Yes.
Are we gonna change those bathroom hours in the winter time? Because that seemed to be when the bathroom situations were the worst, because they
Red
were trying
Park-
to stay warm or,
Right. Right now, no, because at 8:30, usually there's nobody in the parks, and skate park has a lot of people that go up there at night. So if there's a lot of people up there, I just leave them open just a little bit longer. But for the majority of the times, there's nobody in the parks per se that need to use the restroom. So 8:30 is a good time. And Red Park has no heat, so it's closed for the winter.
it's gonna start getting darker earlier too here
Exactly.
soon. So,
Yeah.
And what about along the river, the Arkansas River?
Usually, besides the weather, rain or heat, I don't usually walk that. But I haven't ran into a lot. I haven't found any needles, which was a year ago, you'd find a couple here and there, but now I'm not finding any. And I'll see people, but they keep moving, and of course, with the citizens walking the parks or the river walk, they'll tell me what's going on. And usually it's not that big of a deal. It's usually a homeless camp or whatever that's further on down. Nothing that we need to get involved with. It's in the county.
It's in a different jurisdiction.
Yes.
I know I've had other people ask, can you get the other jurisdictions on board and doing what you're doing so it can be consistent along the river? That would be nice. Any other questions for our park ranger, Officer Zabruski? Yeah, go ahead.
Just 2 from my perspective. One, and I'm not sure if it's a myth or if it really is an issue, but I often hear people say that part of the problem with Macon Plaza is because it's a plaza and not a park. And I don't know enough to know if that actually has an impact on what your capabilities and authorities are there.
Well, because it connects the middle of the town with everything, people just walk through it all the time. It doesn't matter what time of day it is, they just keep walking. It's a shortcut for some. And I don't know,
Yeah. Free
see a
internet,
difference.
public bathrooms at the library.
No, I understand why it's an
Interesting, yeah.
attraction. I often hear that because it's not a designated park, that restricts
The hour
your.
restrictions aren't enforceable. Yeah.
but it still falls under parks though. Like, I mean, our Parks Department still handles all the landscaping and
But in
it's,
terms of charging people with crimes, in terms of being where you're not supposed to be after hours, it hamstrings us, but what was bringing them there was the power. And since we've stopped that, we haven't seen that issue. Now sporadically, we might have a complaint of something that has occurred there in terms of vandalism or something like that, but for the last 4 to 6 weeks, it's credit to Mr. Zabruski and Sergeant Canada, who took it on as a project to identify the reason they were there. They worked to resolve that, frequent patrol checks, and they've moved on to other pastures, so to speak.
And I can attest to the fact that a couple years, even a couple months ago, there was a lot of people sleeping on the benches on Main, and a lot of the business started putting passcodes on their Wi-Fi and those kind of things, and that definitely
Reduce.
had them move on a little bit.
Yeah. So, Marcy, you want to?
Madam Mayor,
Sure.
just one thing for council. We currently have one park ranger, so as we get closer in the budget cycle, be prepared for a proposal to add a second park ranger.
That would be very helpful to get those wraparound services 7 days a week on a schedule. They know when Officer Zabruski's not working.
Mhm. They totally know.
Can I ask one follow-up question on that? Is that also something that would help mitigate the issue? I run a lot on our trails, and at a lot of the trailheads, there are always, not always, there are very frequently cars there that appear to be not there for trail-related purposes, and kind of people there who are hanging out for long periods of time and not necessarily using the parks, whether it's at Sells or at Eagle Wing or at the Hogbacks. And I'm just wondering, is adding a second park ranger also something that would help mitigate that potential issue?
Well, I think, adding the second park ranger is actually to cover the other half of the week. So not necessarily extended hours, but to cover the hours that Officer Zabruski is not on staff or not on duty.
Thank you.
Dealing with the homeless routinely as he does, and then patrolling the campsites and throughout the parks. Probably don't get around to those trailheads as often as we'd like, but we would encourage folks that if they encounter something like that, to call us. If we know the problem exists, then we can certainly give it some focus.
Thank you. I appreciate that. Thanks for the clarification as well, Administrator Stevens.
Well, of course, we kind of stumbled into the homeless outreach side of the business when we first started out. Of course, co-response, our job is to mitigate mental health needs.
Is the green light on in your,
Well, I can push. Ah, ha, ha.
Thank you.
Sorry about that. So when we first started out, co-response, our initial goal is to mitigate mental health and behavioral concerns in the community and try to lessen those that go to the hospital as an outcome or to jail. And as part of that, homeless fell into that category because we don't want the people who are already struggling with either a mental health disorder or physical ailment and having trouble meeting their needs to have to now worry about being put in jail. So we often will get called, and I didn't know where to turn. I got back in January, got pointed to the Homeless Coalition, and we started attending the meetings, and we're able to be there to answer questions. And often, if they run into something they can't troubleshoot, they pass it to us, or vice versa. And none of us would be able to do what we do without the others. It's been amazing to watch the collaboration that's taking place amongst multiple organizations and agencies. And honestly, I feel like I'm kind of a glorified resource officer. Like, people just call me because I know who to talk to. I don't actually own any of the resources, but but we do get calls from Loaves and Fishes if they have to turn someone away because they don't have enough space, but they don't have a tent for that person. Then we can help that person avoid being exposed to elements. We'll go buy the tents, take it to Loaves and Fishes, or go meet the client directly on the street wherever they are. I also want to point out that we were talking about how that they keep moving on from place to place, but our goals and the things that we have lined up, hopefully they'll see how successful the groups are that are currently receiving the support, and they're going to want that as well, and they'll wind up moving to that camp after our people get housed. And we're just going to start seeing this cycle of people coming in and getting that support. But we do want to foster that sense of community with them. We want them to see that they should take pride in what they have available, and hey, understand you're getting lenience to be able to stay on county property and city property because we know that this can be successful and we want you to be successful. And I don't know that they've had a lot of people behind them that didn't give up. So the fact that we keep going around and we keep saying, no, these things are happening, and we make things happen, they're buying into it as well. And by that buy-in, we can teach those life skills of, this is how we keep our area clean, you know, this is how we respect others, and, you know, quiet time from 10 p.m. to 6 a.m. so that people can get rest, and just working through what expectations should be once they get to that apartment. And hopefully we've already matched them up with so many resources in the midst that they've had case managers that have helped with job placements. They've had case managers that have helped with housing. They've had case managers that have helped with mental health. And all of us are able to do that together by having these meetings and making sure that everyone's on board with what's going on.
Yep. So I do have a little bit of data to go over with you guys, both for co-responder mental health stuff and some homeless calls for service. Like Chief Schick already said, a lot of this data is stuff that we're still figuring out ways on how to track. Every time we figure out something else we need to look at or track, we have to come up with a way to do that. So I do have some months of service worth of data here that I'll go over with you guys. For anyone, I think most people are familiar with what the co-responder program is, but for those who aren't, it consists of one sworn law enforcement officer, which is me, and a licensed clinician, which is Marcy from Solvista. Our main focus is responding to calls dealing with a person in crisis. People ask us sometimes, what is crisis? It really can be anything. If someone says they're in crisis, that's it. They're in crisis. It doesn't really matter what it is or what their crisis is compared to other people's. If they say they're in crisis, then we'll be there to help them. So it can be anything. Typically involves people suffering a mental health crisis or episode, suicidal persons, homicidal persons, people suffering from drug-induced psychosis, and goes on and on. So the treatment for a lot of these people kind of looks different based on what their needs are. Some people need detox, some people need respite. It's different for everybody. So we kind of guide them to, you know, that resource, and their success oftentimes depends on resources available and how willing they are to participate in their treatment themselves. So.
And our crisis team through Solvista, that I also am a part of their morning meetings so that I'm abreast of what's going on in their calls, they can let us know how many people have been in touch with that person. We can also, again, that wraparound support that other agencies have spoken about, they may have a peer that's calling them every day to check in and see, hey, well, how was today? What coping skills worked, what didn't? Did you work through your safety plan? You know, reminding them of their steps. Then we'll also, if they fall out of communication, you know, we haven't seen them, they missed their appointment, we're gonna send them a caring card to let them know, hey, we missed you. Is there something we can do to help? We're gonna call, we're gonna follow up and see if there's anything that maybe we failed to do or something that they didn't think they were getting that we need to help continue on. And we do soft handoffs directly to the Solvista crisis team a lot of the times. If we're on a call and I know it's gonna wind up there, I go ahead and say, hey, heads up, probably be a couple of hours, but you're gonna get this call. So, you know, we have this elaborate web that just really does wrap around the members of the community. And, you know, with our homeless population, that's something else we make sure to stress. You know, I told them today, I love the term I heard from a colleague in Colorado Springs, our houseless neighbors. They're not homeless, they are houseless at the moment. I want them to know they're our community just as much as we are theirs, and that they have the support.
Yep. And this co-responder program that Marcy and I are a part of is funded through a grant through the Colorado State Office of Behavioral Health. So there's a lot of stuff that we track that we have to track for the state. A lot of it is kind of HIPAA protected, so there's some stuff that is just kind of aggregate raw data that we can share with you. The variance of calls is, it kind of, you know, there's a range there that it kind of stays in, but there is some variance. it's attributable to a lot of things, social things going on, seasonal things going on, economical things going on in the community, all contribute as stressors and things like that that affect our calls for service. So the total calls there are mental health, crisis calls, suicidal people, stuff like that. You can see that the total number of hours that officers spend on calls and then the total amount that we spend on calls. So a lot of those times, and it looks, depending on the call for service, it looks different for every call. Sometimes it's the officer handing the call off to us. Sometimes it's us only going to a call. There was a call we went to this afternoon that we didn't even require an officer to go to. So it was just the two of us that went to it. It didn't even require an officer. So the little green one is mental health holds by us. We want that number to be very small. Luckily it is. If it's small, it means we're doing our job by keeping people out of the emergency room, finding other ways to treat their crisis, which is a good thing. And then obviously our goal is to get people enrolled into mental health services that aren't already enrolled. And then we de-escalate a lot of people when we arrive on scene. Sometimes people are already calm if a family member is present and they're already de-escalated. Sometimes we get to a scene and we're right at the peak of the craziness. And then obviously if we can resolve the call on scene, that's also a great thing without having to place them in a mental health hold or take them to jail. That's really our ultimate goal, is to divert them from jail and actually get them mental health treatment that they need.
Could I ask a question on that side? I'm just out of curiosity, is there, what's the other possible outcome? So if it isn't the mental health hold, enrolled in mental health services, de-escalation on scene, or calls resolved on scene, what's the other outcome?
Could be anything. It could be, so yeah, we have jail. It could be that they just need to walk away from that situation on their own. It could be that we take them somewhere else, like taking them to detox. Sometimes we'll arrange for them to have respite care. Sometimes we'll arrange for them to get a hotel room. There's lots of different outcomes.
Generally, I mean, but I guess are you asking how many are still going to jail? Are there just?
That's a great question.
Okay. I was just trying to.
There are maybe, I have that data, it's not in here. It's with the people that we deal with, it's maybe once a month, maybe, and that's usually the case if someone has a warrant that I can't do anything about. They have to take care of the warrant.
Thank you.
And then, so here we have, these are Canyon City Police Department case reports dealing with homeless people. We didn't start taking metrics for this kind of data until February. And at that point, a lot of officers were still learning that there's a little checkbox basically in our CAD system that they have to make sure they utilize. So the use of that started ramping up, and I think they started learning more that that's there. Like I said, every time we decide we have to track something, we have to come up with a way to do it. So the one thing that cops hate is change. So if you say, this is how you normally approve a report, now you have one more box you got to check. You know, sometimes they do forget it. But obviously, we're going to keep tracking this forever now, and then we'll have, as time goes on, we'll have a much better picture of what this will look like over time. I'll go into two quick success stories. These aren't, I took most of the details out of here, so you guys, just to protect the person or the people involved. And these are both pretty recent. So we had an elderly person that was living alone, cut off from the world, suffering from severe psychological issues. We had probably over 20 attempts to make contact with this person. The subject's home was purchased in a tax lien sale by another person, and that writ of restitution, the eviction process, eventually did happen through the courts. Because we were involved in this and we had spoke to the neighbors and we knew what the issues were, normally this person would be forcefully evicted, thrown out on the streets, homeless, and they'd have to figure out kind of where they go from there. Because the co-responders, because we were involved and we knew kind of what we were walking into, we were able to make arrangements for an immediate mental health evaluation and to get that person placed somewhere safe for themselves. So we avoided them, being homeless. And apparently I didn't finish that sentence. Another one that we recently dealt with was we're dealing with a subject who grew up homeless since they were a teenager, not 18, but even younger than that. They had used quite a variety of community resources for homeless helps, mental health treatment through Solvista. They stayed in a respite, our respite center here. And this person just had bad timing. The respite place, you can only stay there so many days. So the subject's time was about to expire before he got his housing voucher. He had 3 days that we needed to cover. So we were able to get him set up in a hotel that was able to accommodate his service dog. And we even helped fix a car for him. So those are the kind of outside the box solutions that Marcy and I were able to come up with.
Any questions?
Excellent work. I guess my biggest question is that right now, this is paid, the corresponder program is paid through a grant. And is that something that could be renewable? What are we looking at for long-term?
Well, I think we have renewed, and we've also expanded. We have an additional grant that Phil and Marcy got that will fund another law enforcement co-responder. It doesn't cover a second clinician, but it does afford us a second co-responder. Unfortunately, right now, we're still at minimal staffing, and we can't afford to pull anybody off the road to fill that void or that need. So we're still in hold pattern on that.
And we are continuing to seek funding for a second
Clinician.
clinical position as well.
Yep.
Okay.
And as far as the grant goes with the co-responder through the Office of Behavioral Health, that was a pilot grant, actually, on a pilot program where they initially had planned for doing the program for 3 years. And there was quite a bit of competition to get into that program. Luckily, we were one of the people that did, one of the agencies that did. Since then, they have extended that program indefinitely. So every year, I will be reapplying for that grant. We already have our foot in the door, so we will receive this grant every year until anything changes.
Oh, that's really good news.
And they're really, we talked about this recently. They're really looking to, really expand on their wraparound services to make sure that as these folks cycle through and come back into the community, that, as Marcy said, they're following their doctor's orders, they're talking to their counselors, they're, just keeping them on page so that, they don't spin back into a crisis.
Mm-hmm. So we've talked a lot about a lot of success stories that have happened, but the reality is we still do have 209 individuals that are experiencing homelessness. We just talked last night about an officer who saved the life of someone who was drowning, who was experiencing homelessness, and then just had a press release about a homeless man that hung himself. So there's still issues out there.
Yes,
we also had some park ranger or some park staff that had been threatened. What are we doing for those who are not seeking help? I guess some have been arrested, which is probably good if they're committing crimes. But what do we do for those that are not willing to take advantage of all these wonderful opportunities for improvement?
Well, Marcy indicated, and Dee Dee, it's that continual approach, at not giving up on them, because, as she said, that a number of these folks have experienced that their entire life, where folks are not in it for the long run. So I think it is that continual pursuit of our outreach components, be it co-responders, be it rangers, be it Loaves and Fishes, UOCOG, all of these people continuously reaching out. And as Marcy indicated, they see success in their peers. And then hopefully they make a decision that they want to be a part of that. I don't know that there's another path. I really don't.
Like positive peer pressure.
Yes.
Yeah,
Like-
yeah, exactly.
I want what you got. How do I get that?
Well-
How did you get, I know we were sharing ground space
Yeah.
last year, And now you're living there and have food in the fridge and have electricity, and how do I get there?
Absolutely. And the alternative is jail, and that's not solving anything.
So I have a question for all of you. What are your greatest needs right now? I mean, we've come a long ways, but there still are some gaps.
I think our greatest need right now is staffing. As soon as we get our patrol staff up and we get the additional co-responder, and if we're fortunate enough in the budget process to get another park ranger, I think the longer we stay in this pursuit, the more success we're going to see.
Okay. Dee Dee and Amanda, the same question is for you. If you would like to come to the microphone, what are your greatest needs right now?
I would say funding.
Yeah, we need the microphone for the TV.
I would say COG's need is funding and another housing navigator. We have one person working with 345 people, and that's a big caseload. So that's what we're looking for, is more funding to hire more people.
And I know City Council is working on this. We need more affordable housing. We have got to figure this out. We have, whatever we can do as a community to entice people to build homes here, we need to really do that for everyone, not just for the extremely low, but the missing middle. I think I've heard Ryan speak of that, and so that's what I would say.
Excellent, thank you.
Just a follow-up question on
Yeah.
the funding need. What specific, if folks are motivated and inspired to give, should they be giving to the COG, or is it to Built for Zero, or what specifically should they be looking for?
Any of the programs that are involved in this Built for Zero team need funding to continue doing what we do.
Okay, so Built for Zero itself isn't a 501c3, but each of the individual entities can receive funding.
Correct.
Perfect. Thank you so
you.
much, Amanda. And just, I would love to thank you guys for your presentation as well. I thought it was a fantastic blend of the numbers and then also the success stories, and to thank you for your work. I know it's a very challenging and difficult job, and that's leaving aside all of the requirements that come from grant reporting. So managing all of that and a team of only 2 is very impressive. So thank you very much.
Yeah, thank you.
Excellent. Well, we've come a long ways. I think there needs to be just kind of a moment of celebration and an acknowledgement of the hard work that has gone on, and the different tone that we've experienced in this meeting is drastically different than what it was just 2 years ago, from anger and frustration and hopelessness to we've got this, we're making it happen, and it's just really exciting. So yeah, thank you a million times over for all of your hard work and dedication to our community.
Thank you.
Well, thank you for your support.
All right, well, I think that is the end of our meeting, and we are officially adjourned. Thank you.